The most common reason organizations receive audit findings related to their procedures is not that their processes are wrong, it's that their SOPs don't adequately document them. As the person responsible for quality in your organization, you may already have SOPs in place, but until those procedures are structured to meet the specific expectations of regulatory bodies, you remain exposed. Today, we'll walk through the 6 core components every compliant SOP must include, the language rules that make procedures audit-ready, and the most common mistakes that cost organizations during inspections. Before we get into the components, let's establish what we mean by a standard operating procedure in a regulated context, because this framing matters. An SOP is a documented step-by-step instruction set that ensures a critical process is performed consistently, safely, and in compliance with applicable regulations. In regulated industries, life sciences, medical devices, aviation, manufacturing, an SOP isn't simply an internal reference document, it is evidence. Evidence that your organization understands its processes, trains employees to execute them correctly, and has controls in place to detect and correct deviations. That distinction changes how you write them. These steps work well for organizations of any size and in any industry. Whether you're building an SOP library from the ground up or bringing existing procedures into compliance. So let's get into the 6 components. These apply whether you're writing for an ISO 13485 quality management system, an FDA-regulated facility, or any other compliance framework. Component 1, purpose. The purpose section answers a single question. Why does this procedure exist? This is not a summary of what the SOP covers. It is a justification for its existence. Your purpose statement should connect the procedure to a regulatory requirement, a quality objective, or both. For example, this procedure establishes the process for reviewing and approving document changes to ensure compliance with 21 CFR Part 820, now QMSR, and ISO 13485, Section 4.2. That is a purpose statement. This SOP describes how to review documents is not. Component 2, scope. Scope defines who and what this procedure applies to. Be explicit. If the SOP applies to all controlled documents across your entire quality management system, state that. If it applies only to manufacturing batch records at a specific facility, state that. Ambiguous scope is one of the most frequent observations in regulatory audits. Investigators cannot determine whether the procedure applies to the situation under review. Clarity here protects you. Component 3, responsibilities. Every SOP must define who is responsible for each action described in the procedure. This is not about job titles, it is about roles. The QA manager reviews, the document control specialist files, the department head approves. If responsibilities are not clearly assigned, accountability disappears. In a regulated environment, that is a significant compliance gap. Now here is where most organizations fall short. Not in defining responsibilities, but in ensuring those responsibilities are tied to training records. We will come back to that in a moment. Component 4, definitions. If your procedure uses regulatory terminology, acronyms, or industry-specific language, define it in this section. This is especially important for organizations operating across multiple sites or regions where terminology may not be universally understood. Definitions also provide legal and regulatory clarity. In the event of an audit finding or dispute, precise definitions reduce ambiguity and demonstrate intent. Component 5, procedure steps. This is the core of your SOP, the step-by-step instructions that employees follow. Each step should be written in the active voice, begin with an action verb, and contain exactly 1 instruction. Collect the sample and record the batch number is 2 instructions. Write them as 2 separate steps. Your procedure steps should be written at a level that allows a qualified but new employee to perform the task correctly without supervision. That is the standard regulatory investigators apply when evaluating the adequacy of your procedures. Component 6, references and related documents. The final component links your SOP to related procedures, forms, work instructions, and regulatory standards referenced in the document. This is what creates traceability in your quality management system. An SOP that stands alone, disconnected from its regulatory basis, is a procedure that cannot be adequately defended during an inspection. Now let us discuss how you write the content itself, because correct structure without language discipline will still produce non-conforming procedures. Rule 1, use the active voice. Write, the operator shall verify the equipment calibration status before initiating the process. Not equipment calibration status should be verified. Passive voice introduces ambiguity about who is responsible for the action. Rule 2, use precise modal language. Use shall for mandatory requirements, should for recommended practices, and may for optional actions. This is the language of ISO standards and regulatory documents. Using these terms consistently makes your intent unambiguous to both employees and investigators. Rule 3, one action per step. This deserves its own rule because compound steps are the single most common formatting error we see in SOPs, and they are a frequent observation in FDA Form 483s. If you find yourself writing "and" within a procedure step, split it into 2 steps. Rule 4, apply version control headers. Every page of your SOP should display the document number, revision level, effective date, and page number. This is not administrative overhead. It is a requirement under most quality management standards and ensures that the document in an employee's hands is the currently approved version. Rule 5, write for the reader, not the auditor. Your goal is compliance, but your immediate obligation is comprehension. If the person performing the procedure cannot follow the instructions as written, no amount of regulatory language will make the outcome compliant. Let's look at the mistakes we see most often in practice. The ones that generate corrective action requests and, in more serious cases, warning letters. Mistake 1, vague action items. Verify the process is not an instruction. Verify it how, against what criteria, within what time frame, by whom. Every action in your procedure must be specific, measurable, and unambiguous. Mistake 2, missing or incomplete approval records. An SOP that has not been formally reviewed and approved by the appropriate authority is not a controlled document, regardless of how well it is written. Your approval workflow must be documented, and if you use electronic approvals, those records must satisfy applicable electronic signature requirements, including 21 CFR Part 11 where relevant. Mistake 3, obsolete versions in circulation. If employees are performing tasks based on a superseded version of a procedure, you have an active compliance gap. Document control and version management are not separate from SOP quality. They are part of it. Mistake 4, no defined review cycle. SOPs are not static documents. Regulatory requirements change, processes evolve, and equipment gets replaced. A procedure that has not been reviewed within your organization's defined review period, typically 1 to 3 years, is a flag in any audit. Your quality management system should be tracking review due dates proactively. If your organization is looking for a quality management system that supports SOP creation, document control, version management, and training compliance in a single unified platform, eLeaP was built for exactly this environment. The link to learn more is in the description below. Here is a point that most SOP writing guides miss entirely, and it is one of the most critical connections in a regulated quality management system. Writing a compliant SOP is only half the equation. Demonstrating that your employees have been trained to that procedure and that their training is documented and current is the other half. Regulatory investigators do not only review your procedures, they pull training records to verify that the individuals executing those procedures have documented evidence of competency against the current approved version. This is where organizations that manage their quality system and their training system separately run into significant risk. When your SOP is revised and approved, does your training matrix automatically update to reflect the new version? When an employee completes training to the revised procedure, is that completion record linked to the specific document version? If the answer to either of those questions is no, you have an audit exposure that the SOP itself cannot resolve. A unified quality management and learning management system eliminates this gap. When a procedure is revised and approved, training assignments can be automatically triggered for all affected roles. Completion records are linked directly to the controlled document version, creating a complete traceable audit trail from the procedure to the employee who performed it. That is the standard of evidence that survives regulatory scrutiny. Let's close with the approval and version control process, because a well-written SOP that is not properly controlled is not a compliant SOP. Your approval workflow should define 4 things: who initiates document creation or revision, who reviews for technical accuracy, who reviews for regulatory compliance, and who holds final approval authority. Each of these steps must be documented in your document management system with timestamps and signatures that meet your applicable regulatory requirements. When a new version is approved and is effective, the previous version must be formally obsoleted and either removed from active circulation or clearly archived as superseded. Your document control procedure should specify retention periods for obsolete versions and designate where archived documents are stored. Version control also means that when an employee accesses your SOP, they can access only the currently approved version. If your document management system permits simultaneous access to multiple versions without clear version designation, that is a gap that needs to be addressed before your next audit. Let's bring this together. Writing a standard operating procedure that satisfies regulatory scrutiny requires 6 core components: purpose, scope, responsibilities, definitions, procedure steps, and references. It requires disciplined use of regulatory language, specific and measurable action steps, and a formally documented approval workflow. And it requires a direct connection to your training system that creates traceable, version-specific evidence of employee competency. These are not aspirational best practices. They are the baseline expectations in an FDA inspection, an ISO 13485 audit, or any formal regulatory review in a quality-critical environment. If you would like to see how eLeaP's quality management system and learning management system work together to support SOP authoring, document control, and training compliance, contact us at the link in the description below. And if you found this video useful, please like and subscribe. We publish content on quality management, regulatory compliance, and training best practices every week. What is the most common SOP issue you have encountered in your organization? Let us know in the comments below.